My name is Carl Mund. I'm a physicist here with Jefferson Cherry Hill, and I'm here to show you about our new linear accelerator in treatment vault. So, come with me. Now, many of you know someone that has received radiation therapy at some point in their life, and there's a good chance that they laid on a table just like this. Now, the reason that we call it a linear accelerator is because it is a particle accelerator. This machine is designed to accelerate an electron beam up to almost the speed of light before turning it into a usable clinical beam. And so part of the reason that I tell you this is because I think it's unbelievably cool that even though this machine is accelerating electrons to almost the speed of light, it can do this while rotating a full 360 degrees around the patient. Now this allows us to treat the patients from any angle, and so it gives us a lot of versatility in treatment sites, and it also allows us to deliver a really high dose of radiation to the tumor while minimizing any radiation dose to the healthy tissue surrounding it. Now, not only can this gantry move a full 360 degrees around the patient, but if we need a little bit more wiggle room than that, the table itself is also able to rotate. And so we can treat this patient from any angle and any position. And so this allows us to further minimize any damage to the healthy tissue that is around the tumor cell. Now, when a patient first gets in here for treatment, we're going to set them up in the exact position that we had when we simulated them to create the treatment plan. Now this machine is hooked up with all of the bells and whistles. And so we have 3 forms of onboard imaging on this. Now the first that we're going to use is a cone beam CT. And so when we set up the patient on the machine, we're going to take a CT scan of them. And so this not only allows us to verify that they're in the exact position that we created the treatment plan of, but it also allows us to see if there's been any changes in the tumor volume, either growing or shrinking in between each treatment. If there's been sufficient change, the physician might call for a replan. And then we would design a brand new treatment plan for you before treating you to further guarantee the best treatment possible. Now, the CT scan is what we'll do prior to the treatment, but we also have imaging that we'll perform during the treatment. So you'll see these panels on either side. This is our BrainLab Exact Track. And so in the ground on either side of the LINAC, we have 2 X-ray generators. And so periodically during your treatment, we will take X-ray images of you. And so this allows us to see if you've shifted even a millimeter during your treatment. And so if you have, we'll know it and we'll stop the beam from outside and get you positioned exactly the way that we want to, allowing us to guarantee that we're treating your tumor and nothing else. And so this allows us to shrink the margins on your tumor, further allowing us to maintain the high dose radiation to your tumor while minimizing any damage to the healthy tissue around. Now, the other form of onboard imaging that we have is surface tracking. And so during your treatment, we have a 3D camera that is constantly on you. And so you'll see that this skull here, my friend, is illuminated by this blue light. That is our 3D surface tracking. And so if you wouldn't mind coming over here, on this screen, you will see the 3D surface of our skull. And so if you were laying on the table, we would be able to see any movement that you had during treatment. And so if you were to lift your arm, if you were to sneeze, we can see how much you've shifted, and we'll be able to stop the beam and get you positioned again exactly the way that we want to before we start treating. But as I said, this is our Versa HD, the new linear accelerator at Jefferson Cherry Hill. If you have any questions, my name's Carl Mund, but thanks for touring our facility with me.